Hello and welcome to the Imaging Wire Show. My name is Brian Casey. I'm managing editor of the Imaging Wire. Got a great episode for you today. Our guest is Rishi Nayyar. He is co-founder and CEO of image exchange provider PocketHealth. Rishi, thanks for being with us again today.
Hey, Brian, thanks for having me.
Yeah. So you've been on the show a couple times, and so I think people are pretty familiar with what PocketHealth does. But you've been talking about in past episodes with us the shift toward patient-centric image exchange at providers across the US and Canada. And this is really happening on a pretty broad scale. And this is allowing patients to control and access their own medical imaging. And it's really kind of empowering patients. Can you talk about what PocketHealth has done in helping lead this shift? And can you talk about the idea of patient-centric image exchange and why it's important to healthcare providers?
Yeah, definitely. I mean, we've been working at this problem for nearly 10 years now. We've evolved from this concept of just can we replace CDs with something that's more patient-centric to we really consider ourselves a connected care company today. We help organizations, big and small, really deliver care without gaps. So we have a very robust image exchange platform, and then we have an intelligent patient engagement platform as well, all wrapped up into I would say, one integrated solution that really enables orgs to share the right records at the right time, surface the right clinical insights, make sure follow-ups aren't missed. And it all comes around this concept of the fact that imaging is really that spark to the care journey. It's a critical role in the care continuum. And we believe that through image exchange, through patient engagement, there's an opportunity to engage more deeply with your patients through personalized interactions, intelligent communications, and you can deliver higher quality care. Obviously, that means patients that are going to retain longer, have better outcomes, but it also means that you're not burning CDs anymore. You're using an image exchange where patients can actually get access themselves and then can themselves share with their care providers in full diagnostic quality. So it's all part of this one piece where we think that if you bring patients deeper into the fold, you get them to the appointment on time, you make sure they can get access to their records, you make sure it's all DICOM, it's all diagnostic, everything gets a lot better for the patient and also for the provider.
Yeah. And my guess is probably there's a lot of benefits for patients too, not having to fumble around with CDs and figure out how to, find somebody that's got a CD reader so you can look at your own images. What are some of the benefits that patients get from this?
Really, one, it's they can continue with their care much faster. So that's like just a fundamental nuts and bolts thing. You're not waiting for a CD. You're not going to pick it up when you might be extremely ill or your family member might be extremely ill. You can push it to your physician. That means faster care. Often in situations like this, the moments really matter. But then there's a lot of softer pieces where you understand what's happening better. You're an active participant in your care. You can read your report. We help translate it for you. You actually know what it means. You get a sense of next steps. If there's a follow-up, we identify it for you, we highlight it, we explain why that follow-up is important, why that follow-up imaging is important, or that urology consult or that biopsy next step is critical and you need to do it. You need to talk to your physician about it. And it just puts you in the driver's seat more. It lowers your anxiety. If you're caring for a child or your parent, it makes you feel a lot more comfortable that you can advocate for them better. So there's a lot of these what I would say is soft impact, and that doesn't mean they don't become very, very real very quickly. But there's a lot of, I would say, just really, really good things that happen once patients get brought into the loop.
Yeah, and the follow-up thing I think is particularly important because we've been covering stories on the Imaging Wire of how low some of these follow-up rates are, and patients just aren't getting, the follow-up imaging exams and biopsies and things like that their providers are telling them to. So that's great. So PocketHealth recently did some research and you published a white paper on some of the challenges of legacy image exchange systems. Can you talk about some of the key findings from the paper and maybe how some of these inefficiencies are affecting healthcare providers today?
Yeah, definitely. I mean, we're a curious bunch. We're one of the fastest growing health tech companies in North America, period. And we are replacing a lot of legacy imaging providers. And I think just even from a self-interested perspective, we were curious, well, what's different about our approach and why are things working? Why are we able to get to zero CD where in many other cases, it wasn't possible before with different providers. So to get a deeper understanding of the challenges that we're facing, clients of ours, potential clients of ours, we surveyed more than 200 different decision makers across the US. all in either health systems, hospitals, or imaging centers. And they identified a bunch of challenges with quote unquote like legacy image exchange systems. One is costs. They contribute to cost pressures. There's a lot of pricing that's based on volume, sharing volume. So there's a big issue with imaging volume continuing to rise, with costs increasing year over year. Workflow efficiencies, there is a lot of complexity. It almost reminds you of the EHRs in the early days where physicians were kind of sold that, hey, everything will be on the web and it's easier than writing notes. And in reality, it created more time. And the last thing was delays. It's like sometimes a CD is just pretty fast. And when you moved it to a legacy image exchange platform, it led to the referring physician having not being connected to the network and everything like that. So it really just, this whole concept of a network is really what stood out in the survey, that more than 60% of the providers surveyed said, look, these network barriers just create interoperability challenges for them, and it just really slowed down operations. It was frustrating, and 87% of them, and these are all imaging leaders, these aren't generic leaders in healthcare, they said that, look, the rising operational costs were a major concern. So nearly 90% of them were saying that it was and image exchanges were a key contributor to that, just largely because of how they're priced and that they weren't delivering, I would say, the efficiencies that they maybe had hoped when they implemented it, you could say, 3-5 years ago.
Yeah. You mentioned the workforce shortages, and that's been such an important thing, across healthcare, but also in radiology. Does your solution there at Pocket Health, do you see benefits in helping some of your customers deal with some of the workforce challenges that they might have?
Yeah, absolutely. I mean, 73% of our respondents to our survey said that CD burning was still prevalent inside their organization. So, we asked that question specifically, not like, hey, is it still happening, but prevalent. Like, is this a major part of your operation? So that was a bit surprising. So when we implement Pocket Health, our goal is like, look, if you have a nurse navigator who's manually calling patients to make sure they get their follow-ups done, she can move much more efficiently, or he can only call the patients that are not responding to their automated messaging. If you have film library clerks, they can be reallocated to the front desk and moving people along. If you have people, we still have a lot of organizations that are calling all of the patients that didn't confirm cancel in their appointment reminder solution, because it's just not an effective appointment reminder solution. So we find that you can reallocate all of these staff into more patient-facing roles. They're doing more interesting work. It lowers burnout, and it just makes the entire operation much easier. And it's not just on the clinical side where recruiting is really challenging. It's also on the non-clinical side, and we impact both, which is great.
Yeah. Now, the survey was of a lot of your customers and actual healthcare providers. What sort of things are you seeing with your customers, like specific maybe use cases and specific examples at your customers, how they are overcoming some of the challenges by working with you?
It depends on what their challenges happen to be. So often we have sites saying, look, we're having trouble importing images. That can be data, receiving the images in the first place, and data normalization. Think like your automated risk order creation and ingesting that into their local packs. So we'll go and we'll implement, and all of a sudden now they have a seamless import workflow where they're amending the DICOM header automatically based on these predefined rules, and things are just moving very seamlessly. So now you can reallocate that, let's say, film library clerk into something more productive that they're more interested in as well. An obvious result that we like to get sites to within a couple of weeks of go live is 100% zero CD burning. That's critical. And then you really get into what I like to say is the meat and potatoes of it, which is the patient side, where we survey patients and we see, okay, how many patients are accessing their records? How much is your MyChart or Cerner patient portal enrollment increased? How's your patient satisfaction, your HCAP scores? How are they starting to trend upwards now? If you isolate just for your medical imaging patients, and you will see that impact happening. So there's a lot of, I would say near term, you get those workflow efficiencies, those staff efficiencies. That happens, you could say, almost immediately. And then after a couple of months, you can actually start to measure the patient impact. You can start to say, oh, our follow-up capture rate has meaningfully improved. We have greater patient retention. We're seeing more referrals coming in from our key physician sources. So those are obviously very impactful in a I would say like a challenging economic climate for hospitals and imaging centers, but it's also just indicative of patients are having a better experience. Like none of those things happen if patients aren't having a better experience. It just takes a couple of months to be able to measure that effectively.
So you can provide your customers with data on, how many of their patients are looking at their records and doing follow-up. This sounds like that would be just like a gold mine of data.
It's very valuable. We obviously are very careful to protect patient privacy, making sure that we're not letting providers know where patients share their data. That's not, and providers don't want to know that either. But they do want to know aggregated statistics. Look, are patients signing up in the portal, and how many exams are we transferring over? And are there certain user groups or even modality types of patients that are more likely to access than others, and it tells them where to focus if there's service lines where there's less engagement. So for health systems and imaging centers that are patient centric. And I always like to say is every year there's more and more in that category than there were the year before. For those types of health systems and imaging centers, they care a lot about statistics like this because it points them in the right direction.
And just going beyond statistics, I mean, patient engagement has become so important in healthcare, and it seems like all these tools that you're providing just are kind of going beyond data and maybe creating better relationships between providers and their patients. Would you say that's the case?
It's absolutely true because how often is it that your provider is not a raw data provider to your physician, which is the case that it is most of the time, but they actually teach you something. They hold your hand, they let you understand what happened, why it's happening, what you should do next. And also, this is an experience that's extremely differentiated. If a patient walks in and they're able to get immediate access to records in a way that they can actually sign up for, in a way that's easy for them to use, in a way that they can read a report and it makes sense to them for the first time, that they give them questions to ask their doctor that's tailored specifically based on their health record. It is a genuine quantum leap, like beyond anything they've experienced in any other health system. So that's also because like the bar in healthcare for patient facing solutions has never been very high, unfortunately. But the fact of the matter is that it's very impactful to how patients perceive their providers. We survey patients, and it's a very pointed question. Now that you have Pocket Health, are you more likely to return to this health system for future imaging? And are you more likely to refer friends or family to this health system for future imaging? And, after the discussion just to this point today, it's probably not surprising. It's well over 90% of them are like, yes, so I am more likely now. Because it makes a difference in how they perceive their healthcare provider.
Yeah, definitely. So we talked about some of the data that's available to the providers through Pocket Health. What are some of the tools that maybe patients have available to them if they're on the other end of that portal?
Yeah, so again, starting with nuts and bolts, you get your DICOM imaging. It's rendered nicely for you. It's full diagnostic quality. You get your report. And then you have a suite of sharing tools so you can share with your physician. They don't have to be on Pocket Health. They don't have to create a Pocket Health account. They can receive it. They can receive an access page to their fax number, to their email. You can actually burn a CD right from Pocket Health, which is, just functionality you still have to have these days, with a, DICOM Dear, Windows Auto Run, everything like that. And then we have this functionality called Report Reader. So when the patient is looking at their report, we have great diagrams that pop up if they hover over a body part. If it's a complex medical term, we define that for them, and it really helps them understand what's happening. And then inside My Care Navigator, we have a lot of functionality that providers can turn on or off based on what region they have. But if they have an X-ray, they could get a bone model run over it to see if they're at risk of low bone mineral density. We give them, as I mentioned, with Ask My Doctor, questions that they can ask their doctor based on the report. And we also critically identify any follow-ups inside the report. We flag it. We make sure the patient cannot miss the fact that there's follow-up imaging or follow-up consult, a follow-up biopsy, whatever it happens to be inside their report.
Mm. No, we've been talking about how Pocket Health, fosters a relationship between, the imaging side, the imaging folks and the patients. What about referring physicians? How does it enable referring physicians to improve their relationships with patients and maybe also the imaging department?
Yeah, absolutely. So referring physicians they can create their own account, they can get access to diagnostic quality imaging on Pocket Health. They don't have to be part of a network or paying anything. But also more importantly is they can share, they can receive shares from patients and providers, and it all looks the same in their interface. So from their perspective, they don't care where the patient's from, whether it was the patient that shared with them or the provider, but they can get the imaging, they can get the reports, and soon we'll be supplementing that with non-imaging clinical data as well. Not to replace existing mechanisms of receiving that data, like Epic Care Everywhere or other mechanisms that they may have, but to have it just sitting alongside the imaging data just to make it convenient in one place for them.
Perfect. So we've talked a lot about what you mentioned earlier as kind of the soft benefits of having Pocket Health in terms of, better patient relationships and that sort of thing. But what about the financial impacts of it? I mean, if someone implements Pocket Health, are there also cost savings involved with it?
Yeah, definitely. I mean, we've had sites, save many, many hundreds of thousands of dollars a year. One recent large health system reported to us that they're saving over $300,000 a year, and a good chunk of that it comes from also just removing the CD burning operations at large sites. This could be cost upwards of $1 million a year when you factor in the machines, the labor, and the career costs. It's extremely significant, and then also just the reallocation. We just went live at a large health system that's having two retirements happening in their film library within the next 6 months. So very timely moment for Pocket Health to launch, and they're now in a position where they can actually move that headcount over to other areas of the radiology department. So, you're really able to capture a lot of savings from that perspective. And then obviously you start to receive the revenue benefits, within a quarter or so as you're able to start bringing those patients back and retain them more deeply.
So how do you see the patient engagement field evolving? Pocket Health has been, leading the charge in terms of improving patient engagement with image exchange and that kind of thing. But where do you see it going in the next few years?
Yeah, I mean, I go back to how we started our conversation. Imaging plays a critical role in the care continuum. So we built our platform to resolve these long-standing interoperability issues and make image exchange seamless while also improving patient engagement and satisfaction. So what we're doing is we're helping health systems realize that radiology can be a powerful bridge to patient retention and lifetime value. So when we think about moving forward, we'll keep developing new products to address gaps in this area. So for example, we'll be expanding on our follow-up management capabilities. We'll be giving patients a lot more understanding of, we've spent a lot of time talking about what their reports mean. We're now kind of digging into the area, and we'll be excited to share more at RSNA about what their images mean and what are they looking at. As I think a teaser that I can give to your listeners is if when you meet with us next, whether that's at RSNA, whether that's at SIM, whether that's over a virtual call, ask about our upcoming follow-up functionality and our upcoming patient engagement functionality. We are always working on being on the cutting edge of using that moment of imaging, using that spark of imaging, not just to reduce inefficiencies, improve workflows. I view that as table stakes for any software that's implemented, but really creating that special connection between your health system and your patient, making them a patient for life, for whatever life throws at them from a health perspective.
Let's talk a little bit about Pocket Health itself, your company. So you recently had a funding round and you raised a pretty good chunk of money. What are some of the things that have been going on at Pocket Health, and what can we look forward to on a company perspective?
Yeah, thanks, Brian, for bringing that up. And earlier this year, we raised a $33 million funding round. We had our returning marquee investors all come back with support. We had some great new ones come, including critically, we had Deloitte come in with a large chunk of the investment, and we had Samsung come in with a large chunk of the investment. And with institutional backing like this and capital, what we did is we didn't grow. We didn't work on growing our marketing team. We didn't work on growing our sales team. We believe that what we've been able to see in this market is that as we invest more into product that connects providers and patients together, everything gets better, and the company continues to grow. So we've grown our development team dramatically. We've grown our support, our technical services, our implementation team dramatically, largely to keep up with the increased deployment pace that we've been at. So we hope to continue investments in that area where we are, and I hope always will be, a product-led company. We believe that comes first, or sometimes more accurately, you say patient-led to product. Our patients are never shy to say what gaps they need filled by us. So, we've been very lucky to raise a large funding round like this, and in what is let's say a tighter capital markets environment, and be able to put that to use where I think everyone wants us to, which is build more stuff that's scalable more quickly, can be supported really well, and then we can just get to our mission and what we're trying to do much faster.
Right. Very good. Well, it's going to be really interesting to see where Pocket Health goes. Well, Rishi Nayyar of Pocket Health, thanks so much for being with us today. Really enjoyed our discussion.
Great. Thanks, Brian.
Signing off for the Imaging Wire, my name is Brian Casey.